Well, hello, everyone, and welcome to the International Interprofessional Mentorship Meeting. I am Dr. Kate Barlow, the founder of the program and your host for today's meeting. It's July 14th, 2021. And today, Dr. Sarah McKinnon is here to talk about OT's role in climate change. Please keep yourselves on mute during the presentation, and you can type any question you'd like during the chat box, and I will ask the questions for you. Please enter your name and email if you would like to receive a certificate of attendance, and I will have those emailed out after the meeting. And at the conclusion of the presentation, we will have an optional meet and greet. So thank you all for coming. Sarah, thank you so much. Welcome.
Hello and welcome everybody. Thank you for inviting me, Kate. I am so excited to be able to share with you a unique area or budding area of practice for occupational therapy and the interprofessional team. And that is our role in climate change. So today I'll speak to you for about 45 minutes or so. And again, if you do have any questions, I have my contact information all over this presentation, and I know that Kate will be sending it out as well. I am always inviting and seeking collaborators from all over the world related to this topic because it's such a necessary topic, but there isn't a lot of information really out there related to what we're doing now to address it related to the health professions. So I will start off and just tell you here that there's a lot of work in here. I'll share with you my collaborators, but the list of people you see here are people that I work with, I say daily, but probably monthly. You see, and it's a nice interprofessional team of physicians, nurses, a fellow OT, a physician's assistant, and then also a librarian on our work as well. So as I mentioned, my name is Sarah McKinnon. I've been an occupational therapy practitioner now for about 12 years, and I'm located in Boston, Massachusetts, which is in Northeast United States. My current role is that I am an assistant professor and program director of the post-professional Doctor of Occupational Therapy program at a school called the MGH Institute of Health Professions. For those unfamiliar with the MGH IHP, as we call it, we are a graduate school only, located in Boston, Massachusetts. Yes, we're owned by Mass General Hospital, but we prepare practitioners to work across all settings, across the continuum, not just medical settings. We have graduate programs in occupational therapy, physical therapy, nursing, speech language pathology, genetic counseling, audiology, as well as other PhD programs as well. One innovative center that we have on our campus, and this is really where a lot of my passion has budded and developed, is with a center on site called the Center for Climate Change, Climate Justice, and Health. So the interprofessional team that I shared with you today is a team that I work on related to improving knowledge and skill set of healthcare practitioners, again, across the rehab continuum related to climate change, climate justice, and health. So again, thank you and welcome. Thank you for joining us today. I recognize that although climate change might be more on the forefront of people's minds based on where we are located in the world, we might not necessarily have the knowledge of what it is, how it impacts health, how it impacts participation in occupations, and really what we can do about it, both as a reactive measure, but also in a proactive way in education in the programs that we attend. So today I will share with you an overview of climate change. I'm going to presenting from almost ground zero, if you will. If you have no knowledge of climate change, I'll help increase your knowledge there. And I'll share with you how climate change can affect health and participation, as those are really that core foundational principle of occupational therapy practice is occupational participation, okay? And share with you some insight there. I also welcome your participation in the chat box if you are able to engage in what this means to you when we get there. Given my interest, I joined in with this team, with a lot of members of this team, to evaluate the evidence of what's out there related to addressing climate change for occupational therapy and for the health professions teams. I'll present to you just where the evidence stands right now, and again, an additional model for using the evidence to inform where we're at currently as a profession, and then also to provide some recommendations about what we can do as occupational therapy practitioners, but also how to inform our other team members as well. Our center created a lens or a framework called the Climate Framework, which is a framework that we use as a suggestion to other programs and other practitioners about how you can address climate change in your daily practice or in education. And I'll share with you what that is today as well. So let's get started. I have some nice statistics here to really support not only that climate change exists, but there's a problem related to health and participation. Climate scientists are those that study climate change and the climate. And 97% of climate scientists agree that climate warming trends are due to human activity. So again, what we do in our everyday lives affect the climate health, and long-term participation. The image that you see here, I think I just want to highlight, is where we were just 70 years ago in terms of carbon dioxide levels in our world and where we are now. You see that over the past, thousands of years, the emissions within our environment was below this threshold. You see this bottom number of 1950. And the current level is a massive spike, okay? You don't have to understand the numbers, but more so the trend that for thousands of years, tens of thousands of years, we were at a stagnant level of carbon dioxide emissions. And now we have drastically increased the unsafety of our environment in truly just the last 70 years. So who's responsible for this? I'd say we can't be pointing fingers, but we do have statistics of where the highest levels of greenhouse gas emissions are across the world. So all of us are collectively sharing the same sky and the same environment, although our climate is different where we are around the world, okay? The statistics here indicate that the highest level of greenhouse gas emissions, okay, which are the human activity production that is released into the environment, okay, into the air, the largest percentage of that comes from the environment or the land of China, okay? Next up, the United States, okay, 16%, although the US is just 4% of the world's population. And then the EU, the European Union is next. If we think about healthcare alone, okay, and so when we think about healthcare, all the buildings that come together to form healthcare systems and all the activities of medications, gases, anything that consumes healthcare delivery. And if that was like its own country, that would be the 5th largest emitter on the entire planet, meaning that how we actually deliver healthcare in facilities could actually be harming the environment, okay? Not surprising, the United States is the largest or is the top healthcare emitter of these horrible greenhouse gas emissions, followed by China and the European Union. So the US has a lot to do, but generally speaking, this is really where and who is responsible if we have to point fingers because we have these statistics, but also that the healthcare industry itself is a massive emitter of these negative emissions. The slide here indicates other industries and really where these greenhouse gas emissions come from, okay? So the largest being how we use energy. So whether that's electricity, gas, heating, or cooling, coal, for example. You see healthcare is number 2 on that list. Other manufacturing plants, textiles, metals, number 3. How we create and manufacture food is 4, etc. So you see, it's not just healthcare that's emitting. There's all of these industries that essentially contribute to our global economy that are contributing to these greenhouse gas emissions, which ultimately affects climate change. I know the majority of people on this call are not from the United States, but it is important to understand some of the climate change, the climate trends of where you are and how that can affect not only just the delivery of care, but the health of your community. So the United States is one example that's listed here. Typically, the lower southeast is often heavily impacted by hurricanes and wet weather, whereas our lower southwest of the United States is often impacted by drought and heat waves. Okay, although the climate of those areas of the country are starkly different, the climate can impact the greenhouse gas emissions, okay, and thus the health of the community. So I'd like to share with you how health can be impacted from the variety of topics related to climate change. And I'll go over some examples here. And I'd like to actually think about, or at least start us off. Again, if you're able to use the chat box, great. But I'm interested is when you see these terms, air quality, extreme weather events, diseases, food safety, mental health, okay? What of these topics do you think occupational therapy fits? And for anybody who's on the call, I'll go ahead and let you use the chat box if you're there. But if you're listening in after the fact, I'd just even take time to brainstorm quietly to yourself as you listen to this recording. When you hear air quality, extreme weather, disease, food safety, mental health, where does occupational therapy fit?
We can't hear anything.
I know. Yeah, it's okay if no one speaks. I'm giving people some time at home even to think. All right.
I think I would say, I don't know how it affects air quality, but I think extreme events, vector-borne disease, water-related diseases, food, and mental health. I'm not really sure about air quality. I haven't really thought about it.
Mm-hmm.
Yeah, but I think the rest, OT would fit.
Yeah.
I think all of them.
I think all of them. When I reflect on this slide, I think the thing that calls to me the easiest is mental health, right? I mean, it's the forefront and the core of occupational therapy practice. And honestly, it's beyond an emerging practice area, but it's becoming so much more of the forefront of our minds, not just related to climate change, but other things that are happening in the world as well. I see some hands raised, and I'd like to call on patients. All right, feel free to cut me off when you are able to access and come back to the computer. So initially, my reflection is that mental health is the easiest connection to occupational therapy because actually those terms are part of our scope of practice documents as listed by WFOT, okay, WFOT. The others, we have to make these indirect connections to, okay? So how can disease affect participation? How can not having the energy from not accessing food impact occupational therapy? How can the air quality potentially be so poor that you can't walk outside to go get your groceries or go to school without getting ill? Okay, so there's indirect links that we see that could be related to occupational therapy, although if not even directly published yet in the literature. There's a lot of gaps as to how, not necessarily what the role of OT is, but how a lot of these issues could be impacted by further OT intervention. So let's talk about air quality. I used the example of having such poor air quality that you can't access where you need to be, where you got to go without illness. This is particularly something that is massively important for those with respiratory conditions, allergies, and asthma. We also see it, or you can infer that it might be happening with the recent pandemic and the ongoing long COVID symptoms, So long COVID being those long-standing symptoms related to a positive COVID exposure that one now carries for an undocumented, very long time after onset. So you can have the acute exacerbation that leads to respiratory issues, which could affect participation. You can have other air quality issues related to being surrounded by wildfires, or also high manufacturing areas. Again, like we mentioned, China was #1. There's a lot of emissions there as well. And then that could also impact parenting, the ability to be able to parent healthy children, as well as the inability to access educational settings as well. Then there's extreme events, and this is particularly related to extreme weather events. And so if you think about extreme weather events around the world, that could be in the form of many different types of issues, depending on where you're located. I gave the example in the United States related to drought, which is something we see all over the world, particularly in Africa as well, and also parts of Asia. We also see extreme events related to monsoons, and hurricanes, which again could be seen all over the world in those climates. And when you have these things that happen, many things trickle after. Very reactive things could happen. I mean, the ultimate loss related, of death, but you can also have extreme symptoms such as heat exhaustion or frostbite. Again, those things limiting participation, which ultimately affects interventions that OT can provide. And then the same goes for post-traumatic stress after extreme events. If you've experienced and survived and have some of these things, having long-standing mental health issues. I'll go here. I'm just looking at my time and I want to make sure I talk more about OT. You'll all have these slides distributed to you after the event as well. So food safety and nutrition is something that affects who we are clearly as people to be functioning, healthy, engaged individuals in our societies. Without proper nutrition, we cannot engage in the things, potentially in life roles, but also in activities that are meaningful to us. So access to food is one area that OTs can address, particularly how we are addressing it. So some of the baselines that go into food safety and food quality is related to the environment and climate change, as climate change can affect the chemicals that are in food, okay, as well as those CO2 emissions. If you have extreme weather events, that can affect your food supply, which also can affect your ability to, again, live healthy, sustainable lives. And then finally, I'd like to share that health impacts related to mental health. So exposures to extreme weather events or disasters or atypical scenarios related to the climate can lead to post-traumatic stress disorder, depression, anxiety, and other mental health conditions. Okay. Oftentimes, as occupational therapy practitioners, we're seeing people who already exhibit these symptoms, okay, or these issues. However, there's emerging evidence to support that we can contribute to prevention of these reactive conditions from disaster with education of our practitioners within our own OT programs. There are certainly more people, more types of groups that are more vulnerable to mental health concerns related to climate change. Children, the elderly, women, indigenous populations, those with pre-existing mental health conditions, those who are homeless, first responders. And literature indicates that people with mental illness or diagnosed mental health condition are at increased risk for poor physical and mental health, as well as decreased participation rates in their meaningful activities. So you can imagine now, I've shared just various areas about the environment and the climate that could have negative impacts on society, okay? And I have this diagram here to indicate the problem now that OT can potentially address, okay? So if one experiences a traumatic event related to the climate, okay, they could potentially have increased use of medical care, right, for a variety of reasons. They could have stress related to their climate, their environment, their home, their community. Potentially, they could also have financial worry. They might not have a home, so therefore they are homeless. They might not be able to go to work because they're caring for family. They might not be able to work because of the physical, emotional, or mental symptoms now that they are dealing with after a traumatic event. All of these things, as just a few pieces of the picture, could contribute to decreased occupational balance and engagement. So I mentioned their parenting can change, their access to the environment would change, their access to healthcare, education, work, all could change. And all of those is really that key principle that occupational therapy practitioners can address, okay? There also could be increased mental health concerns leading to all of these long-term health issues. So when we think about all of these acute that potentially turn chronic health issues, okay, it can also impact long-term mental health care. So there was a big hurricane that happened in the United States over a decade ago now, called Hurricane Katrina. And there was a survey that was done of those who had various mental health conditions, or survey people with different symptoms at the time of the hurricane, but then also those, again, reevaluated 1 year after a traumatic event. This graph indicates the significant increase in mental health concerns even 1 year after a massive climate issue. Okay, so increase in PTSD, mental health, suicidal ideation, and suicide plans. So at this time, again, whether you're joining us live or joining us virtually, I'm going to take a moment for you to reflect. Okay. There are certainly elements that we can do that can change how we live and how we emit greenhouse gas emissions. I won't get too much into that today. But when you think about occupational therapy practice, how can we as practitioners address climate change and mental health? So some things that I like to think about, okay, is exactly what we're doing now in our daily practice, but with a greater understanding and the context of how the climate can impact our roles. So oftentimes we, at least, you know, in American OT practice and hopefully across the world, we talk about this occupational profile. So essentially, what are the factors that contribute to an individual that allow them to engage in the things that they are that are meaningful to them? Okay. Oftentimes, examples could be understanding the family, understanding their values, understanding how they spend their time. But one key factor that oftentimes we don't ask is about the climate of where they live or work, okay? Because better understanding those things could also allow us to better understand how to intervene, how to provide strategies, and how to address concerns of occupational deprivation related to climate. So this leads us to our question that brings us to the presentation today. What is the role of occupational therapy and interprofessional teams in addressing climate change? There are Sustainable Development Goals, SDGs, that are established by the United Nations that include topics related to climate change. They are listed here. And really my point related to this topic is that even though this was created 6 years ago, there are goals from global communities, such as the United Nations, that can guide us in how to, not necessarily how to intervene as OTs, okay, but how us as a world and global community are prioritizing various issues related to climate change. Additionally, there are a lot of position statements out there from various interprofessional organizations. I have some nursing and medical associations here, but WFOT has also a position statement on climate change and climate justice as well, to at least better understand what these associations feel as priorities related to climate change. These things helped me in better understanding a little bit about where associations are coming from in terms of what they're prioritizing related to climate change. However, it still contributes to this issue. What are we as healthcare practitioners doing to not stop climate change, but how to integrate climate change principles into how we work with our clients and our patients? So I just, also want to share here that there is still a lot of people in the world that don't believe climate change exists. And again, I'm hopeful that just with some of the statistics that I share with you about how, the increases that, of course, that it is a global health problem, but that there is a large part, if anything, almost the majority of people who this just isn't on the forefront of your mind. So I just want to again commend you for being here today, because without it being, on the forefront of your mind, then we're ignoring the situation. So to better understand what our role can be as occupational therapy practitioners and other interprofessional team members, my team and I just dove into the literature to complete a scoping review. So scoping review being a systematic search of the literature related to a one topic question. Our question that we chose is, what are the roles of health professionals in addressing climate change and interprofessional education? So we chose to really focus on the education piece because we felt as though if there was an intervention for us to be better prepared practitioners, it would be starting at the education level. That being said, a lot of our recommendations and our findings are completely applicable to practitioners, of course, who are outside of an academic environment. So we searched a lot of databases. We included anyone who was discussing climate change and health consequences of health, who also talked about education and clinical practice and professional development related to climate change. We also collected data from all over the world. We were not specific of one country or one area of the world. In fact, we wanted to know where in the world was studying climate change and the health professions the most. And we wanted to make sure that we were encompassing all levels of an interprofessional care team, again, searching all areas of a care team that includes medical literature, nursing literature, PT literature, OT literature, public health, veterinary medicine, it all, okay? Who's studying climate change related to education and practice? And remarkably, okay, we found that there were only 62 articles in our search that focused on addressing climate change as part of an interprofessional care team. So 62, is that a lot or is that a little? I'll tell you, that's a little, okay? With a search of over the past 10 years, to think that there's only 62 artifacts to support that even information and literature and research is even being done in this topic area specific to the health professions indicates a massive gap and opportunity for us to come together, research, and disseminate our findings to the global community related to climate change and the health professions. There were key themes related to our role, okay? So when I say our role, I'm going to now shift related to the interprofessional care team, okay? So themes of our 62 articles indicate that what's being done around the world globally related to climate change are initiatives in curriculum, so pre-licensure curriculum. So think your graduate school or your bachelor's degrees. There's also themes surrounding just healthcare practitioners' beliefs about climate change. There is evidence to support that there is work being done related to interprofessional professional education. There's also literature to support different strategies that we can use as practitioners when working with our clients, so educating just individuals. And then there's also a lot of literature, and the majority of literature out there, of sustainability. Sustainability includes those practices for us to decrease those greenhouse gas emissions. So I'm going to share some recommendations that we found. Again, I'm thinking that the majority of the people on here are occupational therapy practitioners, but there were some recommendations of what other members of an interprofessional team can do in their respective fields to help address the health concerns related to climate change. Okay, and I'm happy to go more into these things. I tried to keep it like kind of as simple as possible. I kind of had like 5 slides per discipline, all right, and I like summarized it down. Medical education, including physician's assistant, have evidence of addressing climate change and clinical practice education, scholarship, policy, and advocacy. In fact, that was the largest area of where climate change education is being addressed in the literature, is in medical education. I'm not sure why. I'd love to hear your opinions if you had one about that. Additionally, because nurses are actually the largest healthcare profession in the entire world, there's a lot of literature out there to support how nurses can change their practices to help decrease those greenhouse gas emissions in delivery of healthcare. So earlier in today's presentation, I mentioned that healthcare, the sector, if it was a country, it'd be the 5th highest country, if you will, that so much of our care and delivery of climate change is coming from the delivery of medical services. And so because nursing is the largest profession delivering medical services, there is a lot of opportunity in changing practices of actually how healthcare is delivered related to that medical side. And then lastly, related to occupational therapy, recommendations for interprofessional education, as also supported by the literature findings of our scoping review, indicated that occupational therapy has an opportunity to address the whole person in identifying how the climate can impact occupational participation. There is a gap in the literature, and also a gap in the literature findings of not so much what is the role of OT, but really how OTs are even educated in climate change, how OTs are educated in even asking or addressing the context of the environment related to climate, and better understanding how climate can affect participation in work, personal roles, and social participation as well. So our team developed, following the findings of this systematic review, we identified a gap in that there is not one consistent way in which people are addressing climate change. Well, of course, there's typically not one consistent way that we address anything globally, honestly. That's also not really even a framework or a model out there of principles that we should, that we even have accessible to us to even speak this language, okay? So as healthcare practitioners, we're not meant to be experts in climate change, nor can you know the ins and outs of climate change from one 45-minute presentation. However, increasing our knowledge in climate change, how it can affect participation, how to even ask about it, and even putting it on the forefront of our minds of how the climate itself can impact all the things that we do that are important to us, can impact the quality of our practice, okay? So this framework was created by our institution, by our Center of Climate Change, Climate Justice, to help provide some guidelines and some things to think about when you think about your professional practice or the environment in which you work and live, okay? And so this is acronym is climate, okay? And we have different things. So first is consciously consider the climate's impact in your region and their potential impact on health and well-being. Okay, so this is more of a reflective C. Okay, so this is where you would, as a practitioner, think about where you live, think about the climate. Okay, think about how the climate impacts your day-to-day. Okay, and think about what would happen if your climate completely changed, how would that impact participation in your everyday life? Okay. The next thing that we can use to guide ourselves as practitioners is L, learn from a climate history. Okay, so this is where, if you, again, where you live and work, if you ever choose to go to a different country, a different part of the world, to understand the climate, understand the impact of climate, particularly the extreme weather events, and how it has impacted your community, because those impacts affect the entire community and affect also too the culture and the values of your community. And again, that's understanding those is part of the ethos of understanding holistically the person as an occupational therapy practitioner. The next part of our lens that we can share is the I, individualize the focused assessment to include relevant climate-related health impacts. Okay, so this is when you are evaluating a client, okay, that you are considering the questions that you are asking in your initial evaluation related to the climate, the roles they have, and potentially understanding some of those health impacts that could be had along the way to be as proactive as possible, and also to better understand the individual. The M, I think, is a little bit more challenging to do as an occupational therapy practitioner, and that is manage acute, chronic, and complex climate-related health impacts. So oftentimes when we think about health maintenance, okay, or disease, okay, we're often thinking more of that medical mindset. And I recognize that that's not a role for us as practitioners based on where we are in the world, okay? In certain areas of the world, health and wellness maintenance is something that occupational therapy practitioners do, okay? But this is where an example of this might be if you're thinking about managing stress related to a climate issue that happens. So for example, if there was a massive event happening related to the climate a year ago in your community, and there is someone that you're working with who might have lost a family member, right? Or might have themselves gone through a traumatic health event related to that disaster, okay? You are helping to manage those chronic issues, whether they're physical, mental, or emotional, into your practice with them. So A of climate, act comprehensively to create a plan that addresses physiologically and psychologically climate symptoms. So this is something we do all the time as OTs, right? We're managing the whole big picture, and you're not just focusing on one symptom, you're focusing on the person. T, tell the patient or the client explicitly in the ways the impacts of climate change have influenced their health, okay? So this is often where that interprofessional team can be really helpful, right? And having collaborations with other members of the team to help educate the client on some of these symptoms and some of the issues related to health. And lastly, the E, evaluate interventions and ensure appropriate short-term and long-term referrals, making sure that follow-up is considered as well. So of course we're doing that as OTs, okay? So it's very challenging to create a framework that can apply to every health profession, okay? But this is an attempt by our center to provide you with a framework for things for you to think about as a health practitioner that really encompasses climate change within your practice. So at this time, I'm just going to take a quiet time for you to either ask questions or reflect. Does this framework, or could this framework work in your day-to-day practice? So here I am, I'm actually part of the team that helped create this. And so things I love are acronyms. Things I love are the way that we're looking at a client holistically. Again, big person, big picture when we evaluate. And that's something that's challenging for me, is that it's actually a long acronym, right? Like it's something that it would be that would be great for you to print out and share with. And again, you have our full support to do that with your workplace. And we actually are in the process of final publication of this framework to be disseminated globally as strategies for you to consider the climate as part of your day-to-day activity. Okay, great. Thanks, Kate. Okay, so at this time, what I would love to do, if people do have questions, is I'd like to take any questions that you have related to the state of the literature, right? Are there any questions related to any of the findings of our study, or any gaps that I mentioned?
Jessica, do you want to take yourself off mute and just ask Sarah?
Yes, thanks. I just wanted to find out, I know you've mentioned nursing and all the other literature and medicine, but I just wanted to find out in rehab, like physios and other therapists, are there any conflicts so far, or are there any thin lines with regards to how therapists approach climate change and how they manage with regards to the clientele?
Great. So there are, great question. Thank you, Jessica. So there's a few points here. One is that the literature does not suggest, of course, that there's a standardized way to approach climate change. There are issues related to that because there are people out there that don't believe that climate change exists. It also hasn't been on the forefront of medical and rehabilitation research because of some of those barriers of knowledge. Okay, and also because of now it's my opinion, because of the lack of ownership of a topic. Many people feel as though there are other things we should be prioritizing in our care with our individuals. That might be true, but when we think about our practice of evaluating the entire person, understanding their environment, but also how the climate impacts their environment is one thing that we should shift as a profession. There are instances of certain places around the world that have integrated climate change education in their specific schools, for example, but without mandating requirements related to climate change initiatives. It is very challenging to create that consistency of knowledge for practitioners.
Sarah, there's another question in the chat box, and it's, can you comment on disaster/risk management with regards to climate change?
So I can a little bit, right? So there are, and I'm thinking of the examples that I have is when I used to work in Florida in the United States, again, that southeastern part of the country that is prone to massive, hurricanes. And work that we did, again, it is so much based on where you're located in your country or in the world related to climate. But there was a lot of initiatives related to risk management and disaster management for that area related to hurricane preparation. So how to, not only how to be safe, but how, if you have a disability or use a device or are wheelchair confined, how you can be safe during these issues. So I can't comment on a global strategy related to that, but I do believe that if your area of the world is prone to a certain disaster, that there are specific educational interventions that do take place to prevent further destruction or disruption of occupational roles. That's very specific to where you are in the country and in the world. I wonder if that person has any examples of what they're doing in their practice, or maybe anyone in the chat room could share an example if they're using or addressing climate change in any way, whether that's a discussion with their clients or how they might be doing that.
Naya, you can go ahead and ask Dr. McKinnon.
Thank you. Thank you so much for the presentation. And as the person who just asked the question in the chat box, because the WUFOT has got a curriculum, a course on disaster management. And I thought that was a response to the various disasters that are happening due to climate change. And it could be a response from the OT side to train occupational therapists on disaster management as a result of climate change. So it's not limited to climate change per se. And there on your other comment, I think climate change is something that is really affecting a lot of people, especially like from low income countries. And some of the things or some of the problems that we see our clients presenting with include malnutrition. A lot of cancers as well are coming up because of this climate change. And you don't really see the climate change per se, but you just see the symptoms and see that maybe people don't have food and they actually don't have, cannot access their food anymore, which is resulting in the malnutrition, or they are now using other things to eat or and other things for survival, which are causing some of these cancers that we see in the clinics every day. So climate change is a big issue, though our focus mainly is on the health aspects and not on the other areas. And thank you for your presentation. I think it helps us to broaden our mind to look into other issues as well. Thank you.
Thank you for your feedback. I think one takeaway that even I, want to further reflect on your comments is there's oftentimes related to climate change, education is proactive, right? If you're interested in the topic, you go learn more about it, right? It's not a required area to learn about. Again, I provided some of my own personal reasons as to why that might be. But that being said, there are different philosophies, or maybe not the philosophies, but there are different ways in which to mitigate the problem of the lack of knowledge and the increased climate impact on participation. And because there's so many different ways you can approach the problem, right? Is it working with the healthcare system to reduce emissions? Is it educating practitioners about what they can do to talk about climate change? Is it providing interventions that are reactive for a community related to disaster management? Like, there's so many different approaches, right? And without the direction of having like those standards in place, it's really challenging to determine what is like the exact thing that OTs should do. And because that isn't defined anywhere, we have that opportunity to create change and integrate this conversation in so many different ways in our practice. So I just more so want to highlight that without a standard in place, we can really interpret and use this information in any way that we see fit in our practice, which again is a great thing, but also a challenging thing when you want to know what everybody else is doing. Everybody is doing something different related to this topic, or nothing at all.
Thank you, Sarah. In the chat box, Mary from Kenya said, for me, it's a new thinking in my field, so I'm ready to explore it further with my client. And Patience also asked in the questions, she said, how do we handle clients with PTSD related to climate change? Do we handle them the way we handle PTSD clients due to other conditions?
Yeah. So who am I to say what we should do? Here I am saying I have this interest, but I'm also in an area in the world that is not as negatively impacted by climate change as where many of you are from. So I would envision that interventions that you would do similarly for people with PTSD would be similar approaches, but with the language of incorporation climate change into part of your assessment or for increasing rapport with your patient. That would be my suggestion. If anybody has any other suggestions, I'd love to hear that.
So Regina just made a comment from Guyana in the chat box, and she said, "Thank you for your presentation. It is a new way of looking at climate change, and she will educate herself on it and how to apply in the tropical regions. Thank you so much," and looking into how OT can play a part. And there's a couple more comments in the chat box. Atta says, "I think with climate change, we have to make international groups called OT and disaster to make ourselves ready for unpredictable events."
Thank you. Great idea. I encourage anyone to build those and email me so I can be a part of it. Again, the perspectives here that I shared with you today are some professional opinions supported by literature. And I want you to know that there's not one way in which we can address climate change. It's still an emerging practice. There's a lot of opportunities for creating something and integrating different things into your practice. And there's even more opportunity for you to share that with the world. There's not a lot out there in the literature, as I shared with our scoping review, that demonstrates best practices related to addressing climate change as a healthcare team. So I have my email address here as well, because I'm seeking collaborators. You don't have to be an expert in climate change, right? But hearing perspectives from all over the world is also helpful for us with intervention development, okay? Not at that stage yet, but our center is looking for ways that we as an institution can help educate the world. And taking in the perspectives of people like yourselves are helpful in developing things that are relevant and that can be translated into your practice all over the world.
Are there any last questions for Sarah before we wrap up for today?
I do have one more question while people ask them, and that is, could people put their country that they're calling in from in the chat box?
Maybe I have a share. You mentioned that calamities and like abrupt events can affect mental health. I think it is. I can relate with Kenya because we've had election clashes in the past. And right now, even in my OT mind, I was like, there's really change in people's mental health. People are easily committing suicide. People are easily killing each other. So for me, it was like, from my OT mind, I just said, probably this could be a long effect from the election, post-election violence. Yeah, so you mentioned it, and I was like, yeah, sure, for sure, it can affect our mental status, our mental health. Yeah.
Mm-hmm. We're also seeing a lot of mental health challenges related to the disaster of pandemic. And there is more budding literature to support that climate change actually does impact the pandemic as well, based on where you live in the world. Can actually impact, of course, your access to resources, also impact how a disease travels. And then again, more literature is coming out about the impacts of climate change on COVID.
There's another comment in the chat box, and I apologize if I'm pronouncing this name incorrectly, Egardia. And she says, besides mental health related effects of climate change here in Uganda, I think we so much affected in terms of nutrition, health workers reaching clients, and citizens reaching health facilities, including rehab centers for the services needed.
I absolutely agree. And I'd love to hear more from you. So I hope that you email me. There's actually also a lot of literature out there that wasn't included in our review, just out of my own personal interest, that climate change and nutrition are so strongly linked to also community, both positively and negatively, where communities come together to nourish each other related to community farming, other practices, but also that there could be a negative impact on nutrition related to a community if there's no access to food. Fights, wars can break out given the scarcity of food. So again, climate change affecting access to nutrition and nutritious foods and any food in general. And the lack of access to that could impact the safety of a community.
All right, well, if there aren't any questions, we will wrap up today. Thank you so much, Sarah. And Sarah's email will be on the slides that I will be sending out. So you will all get a copy of that and it will have Sarah's email. And if you think of a question later, you can always ask her. So thank you so much, Sarah. This was really informative. I appreciate you coming so much.
Absolutely. I look forward to hearing from you all, and thank you for your commitment to your professional development by joining in on this conversation.